Dr. Emma Hitt-Nichols with the new FDA approvals podcast. This is information on the latest US FDA approvals from November 20th through December 1st, which includes Thanksgiving here in the US. Hope you had a wonderful time if you were celebrating that. So first up this week, the FDA has approved Nirogacestat, that's the brand name Ogsiveo, tablets for adult patients with progressing desmoid tumors who require systemic treatment. Nirogacestat is the first drug to be approved for the treatment of patients with desmoid tumors. It's a rare subtype of soft tissue sarcoma. Desmoid tumors are non-cancerous but can be locally aggressive and may invade into surrounding structures and organs. Although surgical removal has historically been the treatment of choice, there's a high risk that the tumor will return or that other health challenges can occur after removal. Nirogacestat works by inhibiting the activity of an enzyme called gamma secretase, which helps activate a signaling protein called Notch. The effectiveness of Nirogacestat was evaluated in a randomized trial in 142 adult patients with progressing desmoid tumors not amenable to surgery, and the study showed a significantly improved response rate of 41% in the treatment arm versus 8% in the placebo arm. Nirogacestat was granted priority review and also received FDA Fast Track and Breakthrough Therapy designations. Approval was granted to SpringWorks Therapeutics, Inc. Also this week, the FDA granted accelerated approval of Pirtobrutinib with the brand name Jaypirca in adult patients with chronic lymphocytic leukemia or small lymphocytic leukemia, that's CLL, SLL, and who have received at least 2 prior lines of therapy, including a Bruton tyrosine kinase BTK inhibitor and a BCL2 inhibitor. Pirtobrutinib is a third-generation non-covalent or reversible BTK inhibitor and is already approved to treat adult patients with relapsed or refractory mantle cell lymphoma, MCL, after at least 2 lines of systemic therapy, including a BTK inhibitor. Pirtobrutinib was approved under the FDA's accelerated approval pathway based on overall response rate and duration of response from the phase 1-2 BRUIN trial. According to the written release from the manufacturer, Eli Lilly, continued approval for this indication may be contingent upon verification and description of clinical benefit in a confirmatory trial. Also this week, the FDA has accepted for priority review a supplemental biologics license application, SBLA, for Enfortumab Vedotin, EJFV, known as Padcev, in combination with Pembrolizumab, Keytruda, for the treatment of adult patients with locally advanced or metastatic urothelial cancer, LAMUC. The FDA is reviewing the application under its Real-Time Oncology Review, RTOR program, which aims to explore a more efficient review process. If approved, the combination would be the first and only antibody drug conjugate plus PD-1 inhibitor treatment alternative to chemotherapy in this patient population. The SBLA for first-line use of this combination is based on results from the phase 3 EV302 randomized phase 3 trial, also known as Keynote A39. Results of the trial found that the combination significantly extended overall survival and progression-free survival compared with standard platinum-containing chemotherapy. The FDA granted the priority review to Astellas Pharma Inc. and Seagen Inc. and has set a PDUFA target action date of May 9th, 2024. Now a word from the supporter of this podcast, Nascent Medical. Is your internal medical writing team tapped out? Nascent Medical is here for you. Our team of native English-speaking MD and PhD level medical writers specializes in providing fast turnaround needs assessments, carefully annotated manuscripts, engaging slide decks, and accurate ad board summaries in any medical specialty. Visit nascentmc.com now and get a speedy estimate between business hours, Monday through Friday, 8 to 6 p.m. Nascent Medical, because you should never be without excellent medical writing assistance. Also this week, the FDA accepted the Supplemental Biologics License Application, SBLA, for Lisocabtagene Maraleucel, that's known as Breyanzi. That's a CD19-directed CAR T-cell therapy. This would expand its current indication to include the treatment of adult patients with relapsed or refractory CLL, SLL, who received a prior BTK inhibitor and BCL2 inhibitor. The SBLA of Lisocabtagene Maraleucel is based on data from the TRANSCEND CLL 004 phase 1/2 study in this patient setting. Lisocabtagene Maraleucel is manufactured by Bristol Myers Squibb and is under priority review. Also, this week, the FDA has accepted a new drug application for Xanomeline-trospium. It's known as KarXT, and that's not to be confused with CAR T-cell therapy, of course. This is an investigational muscarinic antipsychotic for the treatment of schizophrenia in adults. According to the manufacturer Keytruda Therapeutics, the drug acts as a dual M1/M4 muscarinic acetylcholine receptor agonist in the central nervous system and may improve positive, negative, and cognitive symptoms of schizophrenia. Unlike current treatments, KarXT does not directly block dopamine receptors. The NDA submission is supported by efficacy and long-term safety results from the EMERGENT program, evaluating the drug's safety and efficacy. KarXT is not associated with common antipsychotic medication side effects like weight gain, somnolence, or movement disorders. The application for KarXT has received a PDUFA date of September 26, 2024. Also this week, the FDA has accepted a supplemental new drug application, SNDA, for Roflumilast Cream, 0.15% for the treatment of atopic dermatitis in both adults and children as young as 6 years of age. Topical Roflumilast Cream, also known as ARQ-151, is a small molecule inhibitor of phosphodiesterase 4, PDE4, which increases the production of pro-inflammatory mediators and decreases the production of anti-inflammatory mediators. PDE4 has been implicated in a wide range of inflammatory diseases, including psoriasis and chronic obstructive pulmonary disease, COPD. The SNDA is supported by positive safety and efficacy data from several studies, including the phase 3 INTEGUMENT-1 and 2 studies. According to Lawrence Eichenfeld, MD, with the UC San Diego School of Medicine, Roflumilast Cream, if approved, has the potential to simplify the approach to atopic dermatitis disease control for children and adults. The FDA granted the SNDA to Arcutis and has set a PDUFA target action date of July 7th, 2024. All right, that's it for this week. Thank you so much for listening. I do hope you'll be back next week for all the latest information coming from the FDA. Well, not all of the information, but a lot of the information pertaining to the approvals. And do please tell your colleagues about this podcast. That would be a great help. Thank you. Have a great week.